Hi, this is Dr. Jason Tirado, your West New York chiropractor, and today's headache alert, we're talking about headaches and high blood pressure. You know, headaches are really one of the most common pains that we get today in America, and high blood pressure is also very, very common because it affects about 50 million Americans every single day. So could there be a link between the high blood pressure and these headaches? Well, possibly, but not in the way that you think. You know, some doctors actually question whether taking these pain pills actually corrects the cause of some type of a headache, right? But there's also other, perhaps more seemingly silent concerns that you should have. You know, is simply, cutting the fire alarm when the house is on fire ever a good idea? Obviously it's not, right? But if your headache is coming from a problem such as maybe a sprained muscle or ligament in the neck, or maybe a bone that's moved out of place, which is we call a subluxation, is taking a pill or some type of medicine going to really do anything to really help out that joint injury? I don't think so. So, we all see these TV commercials and the long pill aisles in the supermarkets. We must be consuming quite a bit of this medication, and we really have as Americans. But think about it for a second. Could our excessive use of these drugs be causing maybe another problem? Maybe even a problem that might not be explained on the pill bottle label. And those labels with all the information of all the contraindications of taking the medicine, it goes on forever. Researchers actually looked at the over-the-counter medications such as acetaminophen, which is Tylenol, and ibuprofen, which is Advil. And they wanted to see if taking them over the long term maybe elevates the risk of developing high blood pressure. And one of the studies actually investigated about 5,000 women between the ages of 34 and 77, and they followed these women for many, many years. And this study actually compared this with women who did not take Tylenol, and they found that the risk of getting high blood pressure was 93% higher of getting high blood pressure with the women that were taking Tylenol. That's absolutely incredible. For those that were taking non-steroidal anti-inflammatory drugs, for example, ibuprofen, which is also known as Motrin, the risk of developing high blood pressure in older women also substantially increased, ranging from about 78% to maybe even 161% increase. For younger women, the increased risk ranges from about 10% to about 130%. Those numbers are staggering. You'd think that they cause high blood pressure, or that was the only thing that causes high blood pressure. But there are a lot of other things that cause high blood pressure, other than taking these medications. Aspirins were not really associated with developing high blood pressure, but the authors of the research actually showed that because acetaminophen, Tylenol, and things like Motrin are commonly used, they might contribute to the high prevalence of this high blood pressure in the United States. So be careful whenever you're taking these medications, and if you suffer with high blood pressure, be careful when you're taking things like Motrin and Tylenol. That's it for today. I'm Dr. Jason Tirado. If you're suffering with any type of headaches, don't hesitate to give me a call if you'd like to take care of things naturally. Take care, and I'll see you soon.